Hi, I'm Claire Paling. I'm the lead of the social media team for Musculoskeletal Science and Practice Journal, and Gwen Jull is one of the co-editors of the journal and was heavily involved in the recent special issue on headache and neck pain. So I'm just going to ask her a couple of questions about this special issue. So Gwen, can you tell us first of all why the editorial board decided to produce a special issue on headache and neck pain?
Oh, thanks, Claire. Well, neck pain is a very, very common symptom of headaches and of many varieties of headaches. And I suppose what physiotherapists are most familiar with is the neck pain associated with cervicogenic headache. And certainly most of the early research is around cervicogenic headache. But in this millennium, there's been quite a lot of research done investigating neck pain in the primary headaches of migraine and tension type headaches. And it's happening all over the world. And so we thought if we constructed a special issue, our aim was to bring together all of that knowledge of the research undertaken by physiotherapists and have it all in one place.
Yeah. Great. And I think with your research background, you've done quite a lot on neck pain and cervicogenic headache in the past yourself, and you're one of the contributors to the special issue.
Mm-hmm.
Can you tell us a bit more about who else is involved?
Well, we got an international group of guest editors. So Kirsten Lüdke from Germany, Deborah Bevilacqua Grossi from Brazil, and Ziggy Lang from Australia. So they were our guest editors. And then we invited leading physiotherapy researchers from all over the world, as well as emerging researchers to hear really, well, what we did was invite them to write position papers on their research programs. And we also sent out a call for papers so that we could capture what else was going on internationally. And it was good because we got 19 articles in the special issue. So it's quite a good body of knowledge collected together.
Yeah, and a huge variety of backgrounds then, both from people that have done research in the past and people that are ongoing. Is that right?
Yes, yes.
Yeah. Yeah. So could you tell us a bit more about the topics that are discussed in the issue?
Yeah, well, there are position papers on cervicogenic headache and on tension headache and headache associated with oral facial pain. But I think what people will notice is that there's quite a body of papers on migraine, because that really seems to be the thing that's tantalised researchers in the last several years. So, yes, at least half of the papers are on migraine. And what they're attempting to do is to find out what's the origin of that neck pain associated with migraine. So about 70 to 80% of migraineurs will complain about neck pain. And if physiotherapy is to treat the neck, then pain's got to be associated with musculoskeletal dysfunction. And so you'll see that there's many different research questions and methods that have been used by various researchers to try to answer that question: is the neck pain associated with musculoskeletal dysfunction? And I might say that people's there's not general agreement, there's not perfect agreement between researchers, but the readers will sort of see the rationale behind it, etc. But it looks as though probably less than half the people who have neck pain with migraine actually have neck dysfunction. And that's some of the important parts of that sort of research.
Mm-hmm. Yeah, and as a clinician, I am well aware of all the challenges that are associated with neck pain, cervicogenic headaches, the diagnosis, treatment. So how's the special issue going to help clinicians with our headache patients?
Well, I think, especially with the headaches like cervicogenic headache and the headaches associated with orofacial pain, and to some extent tension type headaches. I mean, the research-informed treatments are described in those. Certainly for migraine, treatments have been described, but our certainty of the efficacy of those treatments is yet to be proven. But certainly what clinicians will get is they'll see the approaches for differential diagnosis, which is really the most important thing, because there's no use offering neck treatments if there's nothing the matter with the neck. And that's what has been proved, is that often that neck pain is associated with the hypersensitivity that occurs with migraines. So I think what the special issue will do for clinicians is help them with differential diagnosis. And then indeed, they can help researchers by using that differential diagnosis, trialing treatments on the patients with that with the neck pain associated with cervical musculoskeletal dysfunction, and actually help inform future clinical trials. So I believe that the special issue really does have information for clinicians and definitely information for researchers. There's a good body of knowledge presented there.
Yeah, absolutely. And I just say it'll be interesting to see all those different opinions come together, won't it? I've started it myself, looking forward to reading the rest. So yeah, hopefully really helpful for clinicians and researchers, and for pulling those two worlds together as well.
Certainly. Thanks a lot, Claire.
Thank you.